Hi everyone, excited to be live today. We're about to be joined by Dr. Peck. We are going to be speaking about IUIs. Dr. Peck is going to be joining us in just a minute. She is going to explain to us a little bit more about the IUI process. Hello, how are you?
Figured it out.
We did it.
So excited to be here. Thank
Yes,
you.
thank you. Thank you so much for joining us today.
Oh,
Before we even jump into better understanding of the IUI process, could you start off by just introducing yourself to our wonderful Yesh Chikva community? Sorry
absolutely.
about that.
So thank you all for having me. My name is Alison Peck, and I am a reproductive endocrinologist and infertility specialist. And I practice at HRC Fertility in Encino. And I've been practicing since about 2003. Very proud, very passionate, very excited about helping people build their families.
Amazing. Well, thank you so much for making the time to join us today during lunch. So
My
excited
pleasure.
to have this opportunity. I know that this is a question we get a lot, and I'm hoping through creating this live, we are able to help a lot of people better understand what it is to be told by their doctor that they're about to start an IUI cycle. We get a lot of questions from our participants. My doctor said, I'm ready to start, and I just don't know what that means. So can you start us on day one of that cycle, that process, and what that looks like through till the end of complete IUI cycle?
Absolutely. So I'm
Amazing.
sure your viewers know, but IUI stands for intrauterine insemination, and that's basically taking a small catheter and taking sperm that's been washed by the andrologist and isolated into a little pellet of sperm and immersed with a tiny bit of fluid, which is put into a small syringe. And that syringe is then attached to a long tube, and that tube's going to float through the cervical canal up to the top of the uterus. And we're going to let go and let all those sperms swim around, get through the fallopian tubes, hopefully go find an egg around the time of ovulation. So we want to time that moment of opportunity perfectly. The egg has about 24 hours to find a sperm. So the beginning of an IUI cycle, which usually starts at the beginning of a period, which would mean somewhere between maybe the first to fifth day, no later, would be beginning of IUI cycle. And usually how it starts is, again, with the motivation of getting to the finish line, which is getting those sperm in at ovulation, which happens about 2-ish weeks later. We start off this cycle with an ultrasound, usually performed with a vaginal wand. This is how I do it. And the purpose of that ultrasound, done again before the fifth day, is to look at the ovaries and make sure that on each ovary there's no cyst or already growing egg or follicle. At the beginning of the period is the beginning of the life cycle of an egg that's going to get ready to be released in a couple weeks at ovulation. So the majority of IUI cycles will be coupled with some type of medication, either oral medication called Clomid or Femara or Letrozole. Sometimes it's coupled with some injectable medication of FSH. But the point is, the beginning of the cycle starts with a pelvic wand ultrasound to make sure there's no cyst, to also look how many other potential eggs, or we call them follicles, are in the ovary. A lot of times blood will be drawn, like an FSH, an estradiol, or an AMH value, to get an overall hormone profile. And then if that ultrasound looks good and the blood levels look appropriate, patients are put on this medication from anywhere from starting to the third to the fifth day. If it's an oral medication, it usually lasts for 5 days. If it's an injectable medication, sometimes it's every day, sometimes it's every other day. But once you get started on the medicine, the goal of the medicine is to go to the ovary, recruit a follicle for ovulation. So this is called ovulation inducing or super ovulation for those people that already ovulate. It adds like an extra egg in there. And then around the 10th day, or somewhere between the 10th to 12th day of the menstrual cycle, a repeat ultrasound is done to relook at those ovaries to compare what happened, at the beginning. And at that point, we want to see a big follicle, which just looks like a big black circle on the ultrasound. And every doctor has their range, but to be fair, I'd say anywhere from 18 to 25 millimeters in size. Once we see that follicle, and sometimes we'll see more than one, then we will say it's time to trigger, which is another big word in the world of fertility. Trigger means you're going to take a shot that is going to time the release of your egg from your follicle, and then your IUI will be scheduled somewhere around 36 hours after that trigger. And some of us will actually do an IUI the day before trigger. The day after trigger and the day before ovulation, and others will do it just on ovulation day, which is usually around that 36 to even 40 hours later. So then the patient comes in, the partner gives his sample. Sometimes they bring it from home, sometimes they produce in the office. Then again, back to my first thing, the andrologist washes it, isolates it, gives it to us, we flow it in, and then patients usually rest in the office for about 20 minutes or so. After that, you can just go on and have a nice, wonderful day. I usually tell my patients, you really have 24 hours for that egg and sperm to meet, so it's always nice to seal the deal if possible with another moment of intercourse. I also tell my patients during the cycle that they should start being sexually active around the 8th day of their cycle to have sperm around before the big moment too. And then we basically wait for about 2 weeks to see if the patient's pregnant. And in that time, I use supplemental progesterone to help get the lining ready for implantation. And then we find out, if there's a missed period, then that's a good sign. And if there's a period or a spotting, it's always good to double check and get a blood test to confirm if it worked. But that's basically, in a nutshell, an IUI cycle with medication and with a shot.
Amazing. Thank you so much for explaining that, and very thoroughly. Appreciate that. So now that we understand what an IUI cycle looks like, we took a poll earlier this week to see what the community thought the success rate of each individual IUI cycle looks like. And so I guess to answer that question for the community, what is the success rate of an IUI cycle?
Okay, good question. It's tiered, in my opinion. So I gave you a maxed out IUI cycle. I'd say the tiers range from 5 to 18% for one cycle. If you're just doing the IUI part, because I want everyone to be able to feel like they got the right answer. But if you're just doing the IUI and you're not using medicine and you're not using a trigger shot and you're just checking in your urine when you're ovulating, which some people do that, it's more in the 5 range. When you add the either Clomid, Letrozole, Femara regimen, the oral medication with the IUI, it's about 10%. And when you're using injectable medication, which would be the most aggressive version, it goes up to about 18%. And overall, if you do 3 IUI cycles cumulatively, about 20% of patients will be successful with IUI. We usually like to do no more than 3 if everything's looking good and everything went smoothly with the cycle. And then after that, we move patients on. But I'd say, I don't know what your answers are. I'm kind of curious to hear what people think. But
the poll mostly went on the 5 to 10%. A couple of people, outliers, went to the much bigger extremes of success. But it seems like most people understood that an IUI success rate kind of plateaued at about 20%.
That's great. You have very educated listeners and followers.
Yes, and now even more educated. So you spoke about in an IUI cycle what the goal is of getting that 1, maybe 2 follicles. What happens when 3 or more follicles begin to stimulate and reach that 18 to 22 size? What is the most common next steps for a patient who gets there?
Okay, so the biggest risk, which is the real question underneath the question is of doing an IUI cycle, is the risk of multiple gestation, meaning more than one baby at the same time. And usually when that happens, it's because more than one egg came out as opposed to one egg split or more than one egg split. So a lot of doctors are only comfortable. They have their own little comfort zone of how many follicles they will allow before they would cancel a cycle, which would mean do not have sex, do not trigger, we're letting this one go. I think all of us would pretty much agree. It does depend on the age of the patient. Like our patients over 35 often, or over 40, which oftentimes we're not even doing IUI anymore, but those patients, you could be aggressive. Like if there's 4 to 5 follicles, like it's not that risky because it's hard enough for that it works. It's hard that they're all going to be healthy eggs. So yeah, that'll be probably, most people wouldn't cancel a cycle like that. But if the patient's less than 35 years old and they're making 5 or more follicles, that's a really important discussion between patient and doctor to have. Most of the multiples in the historically of fertility treatment came out of this type of cycle over IVF, where things are more controlled. So I would say 2 to 3 is relatively accepted, but beyond 3 or 3 to 5, it's conversation, and definitely 5 and above would be considered excessive.
Great. Thank you so much for explaining that. And it definitely is such an important piece of understanding why it's so important to be monitored as you are placed on these medications to stimulate, or as you said, hyperstimulate ovulation. And I think that we've pretty much covered
IUI.
Most of the questions in IUI. And I thank you so much for taking the time to do this. But before we end, do you have one last thing that you would like to leave our community with?
Well, I like my mission statement, which I'm sure you all could guess, is like, basically I wake up every day to help and educate women on the beauty of their bodies so that they could perform optimally to create families. So I really think that we're all blessed as women or women helping other women or men to create babies. I think we're all so blessed with our bodies, and it's our job and responsibility to take really good care of them. And if they're not working or performing exactly as we expect, there's no shame in getting help and support, because, that's why I do what I do and so many other like-minded people do what they do. So I believe that if there's a will, there's a way. And if you want it, you just need to go out and get it and make it known, and you will find a way to create your family. So
thank you. Thank you so much. Thank you for taking the time to spend with us and for sharing all of this incredibly empowering information and knowledge with us.
Well, it was really my pleasure, and I'm always here if you have any other questions. And thank you for letting me do this. This is my first Instagram Live, so it's easier than I thought it would be.
Thank you for braving it with us and joining us today. This was amazing.
All right.
Have a wonderful day.
Thank you. You too.